Hi, I'm Dr. Ruben Aquino. I am a 73-year-old practicing ophthalmologist in the Philippines. I underwent femtosecond laser-assisted cataract surgery on both eyes 9 years ago in 2016. Just like any patient, I wanted to have the best surgeon.
Hi, I'm Cesar Espiritu, an eye surgeon from the Philippines. My subspecialties are cataract and refractive surgery and cornea, external diseases, and uveitis, for which I took a fellowship at the University of California in San Francisco. When Jojo Aquino first mentioned the possibility of his having cataract surgery done, the first question I asked was, why?
Just a slight change, particularly in the way I do surgery. When that happened, I chose to have early surgery because my surgery is my life.
And of course, he mentioned his difficulties as far as his vision. In particular, he's having problems with depth of focus during his surgeries. He mentioned that he really wasn't problematic with his daily activities. It was just his surgical challenges as far as being able to see, for example, capsulorhexis, doing the capsulotomy, that really egged him to consider having the cataracts removed and an appropriate IOL implanted to improve his vision.
9 years ago, we already have femtosecond laser-assisted cataract surgery. We already had EDOF lenses. And I knew that by the history of what I wanted to accomplish, I needed good distance vision. I needed an expanded intermediate range. And I also needed a little bit of near vision on my dominant eye. This is because what I want to accomplish in the form of sports and de-stressing in my surgery and practice, I needed to play pool well enough.
Well, Jojo being an eye surgeon himself, the pre-op diagnostics and measurements had to be meticulously done. This included, of course, biometry or the actual measurement to determine the IOL power. In particular, and involving that was doing the accurate measurements for the corneal curvatures or case, the anterior posterior length of the eyeball. We also had to do specular microscopy to make sure that the corneas were healthy. We also had the fundus examined, so make sure that retinas were okay, macula was fine. All those things we really do as a standard procedure in all patients. And all of these we did 5 times, just to please Jojo and to make us secure about accuracy and that we will be able to deliver the expectations Dr. Aquino had as far as his visual results. And mind you, this is standard for all the patients that we do, because it's very important that you end up with patients who are satisfied with the results.
At this point in time, in 2016, there were only diffractive multifocal intraocular lens implants and the introduction of refractive lenses. It was evident from my visual demand that I wanted to avoid glare, halos, and dysphotopsias associated with diffractive design intraocular lens implants. And that's the reason why we chose a refractive lens to give me good distance vision, an expanded intermediate range, and a little bit of near vision.
As he mentioned, he needed a very clear distance vision because of his want for his practical shooting. He also needed intermediate vision because of his being able or want to be able to focus clearly on the sight of his gun for practical shooting, and of course being able to see the cue ball when playing billiards, as well as the target ball. So all of these were being considered in addition to, of course, his visual requirements for doing good surgery. And with all of this in mind, we chose for the first eye, his dominant eye, the LENTIS Comfort IOL, because this ensured a very, very clear, waxy-free distance vision and being able to give him the extended intermediate vision that he wanted for his dominant eye.
I had my surgery at around 8 o'clock in the morning, and by mid-afternoon and early evening, I was already seeing very well. So I was extremely happy with this. And in a period of about 3 months, I decided to have my other eye done.
The second eye, after seeing the results of the first eye, he wanted a little bit more reading. And that's why we decided on using the M+X lens, which had a higher add power. In combination, these two actually gave him an extended and seamless depth of vision from distance to reading. And that's how we used these lenses in his eyes to give him that kind of vision that made him a happy patient afterwards. Well, a day after the surgery, I just had to see Jojo, make sure that he was fine, and everything was fine. He was seeing very well. He had a slight transient increase in pressure, which probably caused some discomfort, a little glare, which actually improved when his pupils came back down to its normal size. And then he went back to Cebu. And because he had an active practice there with great partners who were also ophthalmologists, they were the ones who actually made sure that he was fine until full healing happened. Now he has great vision, probably vision as good as a 30-year-old or younger. So maybe Jojo can fill us in. How have you been, Jo, since 9 years ago when we did the surgery?
9 years after, I see very well. I'm spectacle-free. I see distance with a seamless transition to intermediate and seamless transition to near vision. So I'm spectacle-free all day. The transition from distance, intermediate, and near is seamless. And I'm very happy with that and thankful for the manufacturers of the lens implant, thankful to my surgical team composed of Dr. Cesar Espiritu, Benji Cabrera, and Rich Cole.